Over the years, MS Teamworks has shared different perspectives on MS from patients, care partners, family members, and healthcare professionals. Guided by our mantra, I have MS, I have a team, I have a future, we are proud to share new messages of hope and inspiration with the MS community.
I have MS.
I'm on your team.
I have a future.
My name is Brian Walker. I'm a physician assistant in the Department of Neurology at Duke University. So we're going to talk about MRI, or magnetic resonance imaging, which is a diagnostic tool that we use to image certain body parts. In MS, specifically, we're concerned with the brain and the spinal cord. We can image very specific areas, such as the brain, the optic nerves, or the orbits, the cervical, thoracic spine, or even sometimes the lumbar spine. MRI scans are a highly sensitive tool that we use as a biomarker to initially make the diagnosis of MS, but also follow a patient longitudinally or over time to see how they respond to certain disease-modifying therapies. We can use MRI scans in a number of different ways. Primarily for diagnosis, we use it to make the diagnosis as part of the McDonald criteria to establish a diagnosis. We oftentimes will use an MRI scan of the brain and spinal cord initially, and depending on how patients do over time, we may image just one or two or even three areas. Contrast, or in case for MRI scans, gadolinium, which is different than contrast used for CT scans and X-rays, is used to detect active inflammation or disease activity, such as if a patient is having a flare or an exacerbation. Contrast dye is given through the vein at the time of an MRI scan in order to look for a breakdown in what's called the blood-brain barrier, which occurs during inflammation, which can give us an indication that a patient is having a flare or an exacerbation at that time. MRI scans are done usually in the beginning to make the diagnosis of MS, but we'll get MRI scans routinely after starting a therapy. Usually what will happen is we'll start a therapy and get an MRI scan several months later to ensure that they're still not active. At that point, if they're not, we'll get an MRI scan about every 1 to 2 years, or if a patient is experiencing any new signs or symptoms. An absolute contraindication to getting an MRI scan is if the patient has any type of magnetic metal in their body. That could be something like shrapnel, leads from a pacemaker, leads from a stimulator, or sometimes surgical clips. But sometimes the metal is not magnetic and we can get MRI scans. If there's any question, you should ask your provider or radiology technician before getting the scan. So relative contraindications to getting an MRI scan would include things such as pain, muscle spasticity, or fear. Maybe it's claustrophobia. But what we can do is give medications at the time of the MRI scan to help with these things. Just like any other picture, if you're moving, we won't get a good, accurate, clear picture of what's going on in the brain or the spinal cord. Some structures are very small, such as the optic nerves or the spinal cord, which in some areas is not much bigger than the size of your thumb. So pregnancy is a relative contraindication to getting an MRI scan. Generally, we won't get an MRI scan if a patient is pregnant unless it's absolutely medically necessary. And then it'll depend on the body part that is being imaged and the trimester in which the patient's in. MRI scans are important for the long-term management of patients with MS because it gives us an idea of how disease-modifying therapies are reacting to the brain and the spinal cord. We shouldn't see any disease activity on an MRI scan if the disease-modifying therapy is working. MRI scans are important over the long term, and it's important for folks to talk to their healthcare providers and physicians, physician assistants, and nurse practitioners with regard to any questions that they might have, anything from cost, what study is being performed, or what the results are. One thing patients should remember is that even though we're very technologically advanced, there still is a lot of division between outside radiology sources and, say, if you're being scanned at a hospital system. If you're being scanned at an outside facility or a standalone facility that your provider has ordered the MRI scan, it's super important for patients to bring those scans with them so we can actually see the images. Just like anything, the old adage goes true that picture is worth 1,000 words. So we might get a radiology report, which is a document that describes the actual images, but it's very important to bring those images in with you to your visit so that we can actually see the images. Also, we might be able to view a report from, say, a different hospital system, but we're not actually able to see the images from that hospital system. So again, it's important for you to get those images and bring them into your appointment with you. MRI scans can cost a lot of money. There's a lot of technology that goes into it, and the price can vary from location to location. So it's important for you to talk to your provider about that. Sometimes insurance companies will dictate what radiology facility a patient will have to go to. Now, most of the time it doesn't matter as long as we're able to get those images and see those images. However, sometimes it does make a difference between the type of scanner that's being used. There are different types of scans with higher resolution. Say a 3 Tesla or 3T scan is a much higher resolution and better picture than, say, a 1.5T or 1.5 Tesla scan that maybe some community radiology facilities would have. Also, we discourage the use of using open MRI scans as those images are a little less quality than we get from a closed MRI scan. So again, we know that claustrophobia can be an issue with some patients, but we're more than happy to give some medication to help at that time to, again, get the best images as possible. Some patients actually don't realize that, which is interesting in and of themselves. You can see the angst or anxiety on a patient's face when you say that you have to have an MRI scan, and it's not necessarily because they're afraid or they're having an issue with getting into the MRI scanner itself. It's all around the cost. Some patients have insurance companies that if you go to their website and you type in an MRI scan and their zip code, they will give you locations and the cost of the MRI scans for those different locations. So it's really important for patients to understand that we respect the fact that MRI scans are costly and they take time and they also cost a lot of money. We want to make sure that we're working with that patient in order to get those scans. One other point to keep in mind is that the MRI scan looks at anatomy. It doesn't tell us what the function of the brain or the spinal cord is doing. So oftentimes patients will say, well, you're saying that my MRI scan is stable, yet I'm still having these symptoms. So it's very important for us to continue to monitor MRI scans over time so that taking a look 1 year, 2 years, 3 years back will give us a good idea of how the next 2, 3, or 4 years in the future will be. We try to use different technology to look at things such as atrophy, brain volume loss, and so forth in order to make some of those predictions. But again, we're limited by the fact that the MRI scan is really looking at anatomy, not measuring the function. The length of time that a patient spends in an MRI scanner will depend on what it is that we're actually trying to image. If it's just an MRI scan of the brain, that might be about 40 minutes. But if it's an MRI scan of the brain and the entire spine, that could be up to an hour and a half, which is a long time in an MRI scanner. Additional time could be placed if we're using contrast dye because the pictures have to be taken both before contrast and after contrast. So the time that you're in the machine could vary quite a bit based on what structures that we're imaging, and then if we're using contrast or not. So be sure to ask your provider about what type of scans are being done in order to prepare you for how much time you're going to spend inside the machine. We can image different areas of the brain and the spinal cord. Sometimes we image all of them. Sometimes we order and image just a certain part. Most of the time, if we're getting images based on new symptoms, it might just be a certain area. So if a patient is coming in with, say, low back pain and numbness and tingling in a leg or both legs, then we might actually include the entire spine, including the low back or lumbar spine. Sometimes we have patients that have symptoms that aren't related to their MS at all, but an MRI scan could give us an indication as to if something else is going on that could be contributing to their symptoms, such as a pinched nerve from an enlarged disc. The main thing that I'd like patients to remember after watching this video is that MRI scans are important for making the initial diagnosis of MS, but also monitoring long-term how they're doing.